Today, we're going to be speaking with Jonathan Cohn, who's a senior national correspondent at HuffPost and also author of the book, The 10-Year War, Obamacare and the Unfinished Crusade for Universal Coverage. Great to have you on, Jonathan.
Thanks for having me on the show.
So to start with, for a while, the way that particularly the right, but even sometimes Democrats would talk about Obamacare was this sort of like appendage onto what was there before, which could be cut off and separated kind of at any time. The language of, well, we can repeal it and we'll put something else in place. Correct me if I'm wrong, but we seem to be getting beyond that to where Obamacare is no longer this kind of standalone appendage to the healthcare system, and it's just more part of the status quo, and it's becoming more of the system that we would have to modify or work off of if we want to do further changes. Is my perception accurate as far as that goes?
Yeah, I mean, I think just by default, almost, when you have something that exists for as long as the Affordable Care Act has existed,
Mm.
um, when it's so entrenched in our system now that to pull it out would be very hard. It's true. People have insurance that they rely upon. The healthcare industry is now sort of reoriented itself around having this program in place, and so pulling it out now is you have to pull out a whole bunch of wiring that goes with it. And it's interesting because historically this is one of the obstacles to passing reform, right? It's that the status quo is always hard to change. Well, now the Affordable Care Act, that's why it was hard to pass the Affordable Care Act. That's why it was such a fight and continued to be such a fight. But now it's been around for 10 years, it's now it's part of the status quo and it's hard to change. And I think you see that in part by the behavior of the Republicans who don't really talk about repeal anymore, which, as you know, it wasn't that long ago. It was all they could talk about.
Yeah, and sometimes I hear the criticism from folks who believe that the Affordable Care Act doesn't go nearly far enough, and I'm under that umbrella to some degree, but not. There's certainly a spectrum within that. Sometimes you hear the critique that Barack Obama should have started at the position of Medicare for all and then negotiated to something that would have been better than what we got. I don't subscribe to that exactly because, I mean, he wasn't for Medicare for all. It would be unlikely to expect someone to start a negotiation with a position that's not even their stated position. But I do think that maybe there would have been a way to end up with a public option. Having chronicled the way that this all came together, is it unreasonable for me to think that some other approach might have given us a public option back in 2010?
So I wouldn't say unreasonable, certainly. I mean, any critique is reasonable, and I think reasonable people can debate about this. I will say I'm very skeptical of that argument,
Mm.
though, for two reasons. So number one, in studying the history of healthcare, there was a century of working on this basically, and almost without exception, it was a failure. Reforming healthcare is really hard. Reforming it given the constraints of the United States government, where the Senate and the power of special interests is even harder. The country politically was in a different place 10 years ago than it is today. I mean, I think a lot of people who are more progressive minded don't remember that, the political conversation was just a more conservative conversation. We were still in the back end of the Reagan era where everyone was very skeptical of government. And the only reason healthcare reform got as far as it did, and I talk about this a lot in the book, is that there was a real effort for the 10 years leading up to the Affordable Care Act, so the 10 years before the 10-year war, by Democrats to really get together and say, look, the only way we're going to get through this, the only way we're going to overcome our past failures is to all get on the same page. And Medicare for all was just not in the conversation. It's not like it was today, where it had been the subject of a presidential campaign for two consecutive elections, where you had sort of visible proponents who had a big grassroots movement behind it. So, if Obama had gone in sort of, offering to do Medicare for all at the beginning, I think just there would have been the whole thing would have fallen apart. And in terms of getting a public option through, now obviously he did endorse a public option. He ran on a public option. It was part of his plan. At the end of the day, they took it out, and a lot of progressives felt like he never really fought for it. And there is something, there's maybe something to that. I think a lot of progressives felt like he could have pushed harder. The flip side of the argument is the votes were not there. In the United States Senate, there were a whole group of senators, and also in the House there were some conservative Democrats, although it was less of an issue there. But in the Senate, you had a bunch of conservative Democrats who would not vote for it, and they had no margin for error. They needed every single vote. And I don't. It's really hard to imagine a scenario where you could get it through, especially given how opposed the sort of most conservative members of the caucus. I mean, when they got to the bill and they were getting to the end, they got to 55, 56 votes. They couldn't get Joe Lieberman. They couldn't get Ben Nelson. Both Lieberman and Nelson were dead set against the public option, and there were others who were not so vocal about it, but were also against it. So I have a hard time seeing how a bill passes with a public option in it.
Yeah, I mean that to a lesser extent we saw this with the $15 minimum wage in the recent COVID-19 relief bill, where there were some who were saying this is as simple as overriding the parliamentarian and putting the $15 minimum wage into the bill. But then it simply wouldn't have passed because it doesn't seem Democrats had the vote. I mean, obviously Obamacare was bigger and changed in a more systemic way a lot of aspects of how the system worked. But sometimes maybe people forget that there's still a lot of very centrist Democrats in the Senate.
There are. It's the same exact problem today. I mean, and it's always those, senators on the fringe who have the leverage ultimately, and they have the leverage. Let's remember why they have the leverage. I mean, obviously, if you're in a situation where whether it's you're going for 60 votes or 50 votes, and you have exactly the number you need, so that's this. Let's say today you have exactly 50 Democrats. Obviously any one senator can object and sort of hold up proceedings. And so they, in theory, have leverage. But at the end of the day, on the Affordable Care Act, at least, what happened was the people who were in favor of reform, the liberals, the progressives, they wanted this very badly. This was something, getting universal coverage or getting close to universal coverage. It was in their DNA. It's why they got elected to Congress in the first place. And the more conservative Democrats, a lot of them, they were in favor of it. But, they weren't that passionate about it. And they would have been okay dropping it or at least compromising to something much, much smaller. And so, in a game of chicken, who wins? It's the one who's willing to kind of let it all go and fall off the cliff or have the crash or whatever the analogy is. And, the liberal Democrats in the day weren't willing to let this thing die. And as a result, they had less leverage.
There's no question that there are some who maybe understate or maybe understand the good things that came from the Affordable Care Act. And there's a list that probably will ring a bell to many in my audience, including establishing exchanges, the pre-existing conditions provision, young adults being able to stay on their parents' insurance until age 26, and many other things. On the other hand, when you see that premiums, even within the exchanges, and me as a self-employed person, I have one of those plans. The price of these premiums is going up in a cartoonish way that dramatically outpaces inflation and cost of living and all these other things. It's hard to feel as though it came close to doing nearly enough. What I'm curious about is, does it help set up whatever the next step is going to be? How does it serve as a bridge to what so many of us know has to have more done on it? Or are we really just starting fresh again whenever someone decides to take it up? Maybe it'll be this administration.
It's a bridge, and I think it's a very big bridge. I think it has put the building blocks in place, a lot of the key building blocks of what I would consider a working universal healthcare system, right?
Really?
So, yeah, absolutely. What I consider, how do you define universal healthcare? Let's take a step back.
Yeah.
A universal healthcare system, to me, and I think is a sort of generally accepted definition among people who study this, everybody has insurance, everybody has good insurance, so they're not facing bankruptcy if they have big medical bills. They don't have to worry. They don't forego care because it costs. And there's some kind of, principle that everybody can get insurance regardless of pre-existing medical condition. And then there's, some kind of control of costs, so you keep the system from becoming too expensive. Now, we haven't fully realized any of those yet. But what did the Affordable Care Act do? Well, first thing is it got 20 million people insurance. So right away, you've closed the gap significantly to the number of people who don't have insurance. You've put standards in place for what insurance should cover. the standards aren't strong enough, but they're stronger than what was before.
Right.
Similarly, there's, if you're buying on the exchanges, there is financial assistance, there are subsidies. The problem is for a lot of people, they haven't been big enough. And so people like you are paying these crazy premiums. So how do you build on that? Well, actually, we're actually seeing that right now. The Biden administration, the Democrats with the COVID bill actually took the first step towards that, which is they threw a bunch more money into that financial assistance. So those premiums will come down, the out-of-pocket costs will come down. They should probably come down further to really get to a universal coverage system. And by the way, now you need to start thinking about people with employer coverage who have high premiums and high deductibles, and what are you going to do for them?
Right.
But you've made progress. You've established this key principle that everybody is entitled to insurance regardless of pre-existing condition. And those are two very big building blocks of a universal coverage system. So there's more to do.
Yeah.
But you can certainly build on that. Now, whether you build on that by just making the Affordable Care Act more generous and opening up the exchanges to more people, or you say, look, what we really need is some kind of public option that can eventually grow into a Medicare for all system, or we just need to go to a Medicare for all system. I mean, you can take those different paths to universal coverage. But to me, at least, I feel like we've moved down that road regardless.
Yeah, the late Uwe Reinhardt, who's written about this, has your definition of what we mean by universal. It doesn't have to be Medicare for all. And he talked extensively in his last book, I believe it was, about the way that those systems could look. I guess maybe the zoom out is conceding all of the things you said. If we make an Obamacare's worth of progress every 11 years, we're a long time from a system that many of us would consider to be a system that's working really well.
Yeah, well, I would say, I mean, that's an interesting way to put it. I haven't quite thought of it in that way, but if you think of, let's create a unit, Obamacare units. Right?
Yeah,
that's a unit of progress.
Right.
One Obamacare, two Obamacare. So we just took an Obamacare unit, and I'd say the 1960s we took an Obamacare size unit with Medicare and Medicaid. Some people would argue that was bigger. Someone also was smaller, but let's, for sake of argument, say that was an Obamacare kind of leap. So I'm guessing maybe one or two more of those leaps gets you there pretty much. I mean, we did close. I mean, with this Obamacare leap cut the number of uninsured in half, basically. So, I mean, that's a pretty big jump.
I think the problem with that, Jonathan, would be, listen, like, as I'm going to tell my audience in our next segment about a recent, interaction with the medical system, I pay $520 a month for a silver plan. I don't get a subsidy. I don't deserve a subsidy. I can afford it. That's totally fine. But there's a lot of people who also are much closer to the edge on when they get a subsidy, who would pay my same $520 a month and still have a $75 copay and still have a $2,000 lab deductible to meet. It's completely unaffordable. So I feel like for them to say simply 20 million more people got care, many of them are paying for the premium, but they can't actually afford to use any of the care. And that, I think, is not in those numbers that is so, just, hey, we cut it in half. Yeah, but a lot of those people aren't really using the care because they can't afford to.
Sure. So the last thing I want to do is to downplay that in any way. And I spend a lot of time in the book talking about those problems and those people. So I completely agree. And is why we have so much more to do. I would say that it is also true that for all the people who now have insurance that they can't use, there are a lot of people who got better insurance and got cheaper insurance. And that also doesn't show up in the 20 million.
Right.
But there are a lot of people who were buying on their own who actually now are paying less. And again, I do think these enhancements that came with the COVID relief bill are going to make a difference. Because I mean, I don't know where you fall on this spectrum, but one of the things, it basically said to everyone who's now buying on the exchanges, if you're already buying subsidized coverage, you're going to get a bigger subsidy. And if you're one of those people who doesn't get a subsidy, you might be eligible for one now. Now, again, I think even when that's all done, this insurance is going to be pricey for some people, and there are going to still be people who pay too much. And again, I don't in any way want to downplay that or say that's not a reason that we need to act soon. But I do think, it is sort of, it's a tough kind of get across, especially if you're a politician. But somehow you need to get across the idea that we actually did accomplish a lot and we still have a lot to do.
Yeah, I think that's the best way to say it. Much was done and much remains to be done. And of course, in these next couple of years, when Democrats control the White House and the Senate and the House of Representatives, we'll see whether anything does get done. And certainly what was in the COVID relief bill also shouldn't be understated. The book shows both sides, and the book is called The 10-Year War: Obamacare and the Unfinished Crusade for Universal Coverage. We've been speaking with the book's author, Jonathan Cohn. Jonathan, I really appreciate your time today.
Thanks for having me on the show.